I knew that your body sends signals up to a month before a stroke occurs. Strokes affect millions of people worldwide each year. It is a serious illness that can cause severe disability and death. However, symptoms may not appear immediately. It can take hours or days before someone realizes there is a problem. Stroke symptoms are often subtle and not recognized immediately. A stroke is a medical emergency because it occurs when blood flow to the brain suddenly stops. This deprives the brain of the oxygen and nutrients it needs to function. The affected brain area begins to die as oxygen-deprived brain cells, neurons, are quickly lost. A stroke can cause irreversible brain damage by killing thousands of neurons every second. Unfortunately, many people do not recognize the early warning signs. This can delay treatment and, in some cases, cause permanent disability or even death. Strokes and cardiovascular diseases are increasing worldwide, especially among younger people. This alarming trend underscores the importance of recognizing the subtle symptoms that may appear before a possible stroke. Do not ignore the warning signs, even if the symptoms seem minor or unrelated. These signs can appear up to a month before an actual stroke. Many people misinterpret them as something else. It is important to recognize the early signs and act quickly to reduce risk. Seek immediate medical attention if you notice any of the symptoms described in this video. A stroke may be imminent. Early intervention is crucial for preserving brain function and saving lives. We will look at 7 symptoms that may be experienced a month before a stroke and analyze how they can be used to prevent this potentially fatal condition. You will have a better chance of preventing or minimizing stroke damage if you can recognize these symptoms in time. By the end of the video, you will learn what to watch for and how to react to it. Understanding these warning signs is crucial in our fight against strokes. Recognizing these warning signs could save your life or that of a loved one. This video will help you do that. Medical professionals emphasize the importance of listening to your body signals and knowing them. Share this information with anyone you think may be at risk so they can stay alert and act before it is too late. The first sign is persistently high blood pressure. High blood pressure can increase the risk of stroke. When blood pressure is high, blood pushes against the walls of the arteries. This can cause a lot of strain on the heart and blood vessels. High blood pressure, also known as hypertension, can cause various health problems, including an increased risk of stroke. Hypertension can cause both ischemic and hemorrhagic strokes. It can make blood vessels weaken, narrow, or rupture. A hemorrhagic attack is caused by the rupture of a blood vessel in the brain. Blood enters the brain and causes a hemorrhage. When hypertension causes narrowing of the arteries that carry blood to the brain, it can cause an obstruction, leading to an ischemic attack. Hypertension can cause damage over time, so it is important to control it before it causes a stroke. It is important to monitor blood pressure regularly and take action when it is consistently high. It is important to take prescribed medication and follow the doctor's instructions if you are diagnosed with hypertension. Adopting a healthy lifestyle that includes regular physical activity and a balanced diet, as well as reducing salt intake and avoiding excessive drinking, can help you maintain healthy blood pressure. Do not ignore hypertension. Second sign, excessive fatigue. Extreme fatigue or excessive tiredness are also warning signs of a possible stroke. This type of fatigue is different from normal tiredness caused by lack of sleep and physical activity. The fatigue associated with an impending stroke can be more intense, persistent, and feel out of place. This type of tiredness does not go away with rest and can persist even when no physical activity has been performed or sleep deprivation has occurred. It may be due to changes in blood flow to the brain. Atherosclerosis, or the buildup of plaques in the arteries, can narrow an artery, restricting blood flow and reducing the oxygen and nutrients reaching the brain. The brain may have difficulty functioning properly due to a lack of oxygen. Excessive fatigue is also a warning sign of a transient ischemic attack, TA, often referred to as a mini-stroke. A TIA is a brief interruption of blood flow to the brain. Although symptoms usually disappear within a couple of hours or minutes, they are a warning sign that a stroke may occur. TIAs can be overlooked due to their short-term nature and the fact that they resolve on their own. However, these symptoms are important warning signs. Consult a medical professional if you feel unusually tired. Early intervention can prevent a stroke by identifying a problem in your vascular system. Third sign, vision problems. Take any sudden change in vision seriously, as it could indicate a stroke. Blurred vision, double vision, difficulty focusing, or even partial vision loss can be signs that the brain has suffered circulatory damage. If blood flow to the brain is restricted or interrupted, it can affect various functions, including vision. The brain relies on a constant flow of oxygen and nutrients. The obstruction of an artery supplying blood to the eyes is one of the main causes of vision problems in stroke patients. This obstruction can cause blurred or double vision by blocking the flow of oxygen to the optic nerve and brain. There are many other causes of vision problems, such as migraines and eye strain. However, any sudden change in vision should be investigated, especially if accompanied by stroke warning signs. Vision problems may be temporary but should not be ignored. They could indicate a more significant issue with blood flow to the brain. Consult your doctor if you notice any of these symptoms. Fourth sign, weakness or numbness in the extremities. One of the early signs of a stroke is numbness or weakness, especially on one side. It could be a sudden loss of sensation or movement in an arm, limb, or even on one side. The loss of strength or sensation usually affects only one part of the human body. It could be an arm or a leg. It can also cause difficulty walking or grasping objects. Symptoms may be brief and disappear within hours or minutes, but they should not be ignored. It is important to seek medical attention even if the numbness and weakness go away on their own. This will help rule out a stroke or other neurological problems. These symptoms can also indicate a transient ischemic attack, TIA, a condition that often precedes a stroke. It is important to seek immediate medical attention to identify the underlying cause of the symptoms and take necessary measures to prevent further complications. Fifth sign, speech problems. Another sign of a stroke is difficulty speaking. It could be slurred speech, difficulty forming words, or an inability to express thoughts clearly. The person may not be able to form complete sentences or have difficulty understanding or responding to simple questions. Aphasia is a language disorder that affects speech production, comprehension, and understanding. Speech difficulties can worsen after a stroke if the brain does not receive adequate blood flow. It is important to take speech problems seriously and seek immediate medical attention. Seek immediate medical attention if you or someone you know experiences sudden speech problems. This will help prevent a stroke from causing lasting damage. Sixth sign, sudden and intense headache. When accompanied by other symptoms such as vision problems or numbness, a sudden and intense headache can indicate a stroke. Although not all headaches are signs of a stroke, sudden and intense headaches without warning should be taken seriously. The headache that occurs after an ischemic or hemorrhagic stroke is usually caused by reduced blood flow to the brain. Hemorrhagic headaches are often described as the worst headaches a person can experience. It is important to seek medical attention if you experience an intense and sudden headache that is unlike your normal headaches or is accompanied by neurological symptoms. The rupture of an aneurysm can cause a sudden headache. This is a severe emergency that requires immediate medical attention. Seventh sign, other neurological symptoms. Other neurological symptoms may also appear before a stroke. Memory problems, nausea, vomiting, or difficulty concentrating are some symptoms that may appear. These symptoms can appear weeks or days before a stroke and may indicate underlying issues with brain blood flow. These symptoms can also be due to other conditions such as seizures or infections. It is important to consult a medical professional for a thorough evaluation. Early diagnosis and treatment are crucial as they help identify the cause of the symptoms and can prevent a stroke. You already know that an interruption in blood flow can cause a stroke. Alcohol and drug abuse, obesity, and an unhealthy diet are also risk factors for stroke. Depression, anxiety, and a sedentary lifestyle can also cause a stroke. All these factors can trigger processes in the body that can lead to a stroke. Strokes are not always accompanied by symptoms. Prevention is key. Avoid processed foods, sugar, and excess saturated fats. Control your cholesterol and schedule regular checkups with your doctor. You can prevent a stroke by taking these measures. Every small change you make in your lifestyle will significantly impact your long-term health. You can reduce the risk of stroke by taking steps to lead a healthier lifestyle, such as managing stress, eating more fruits and vegetables, staying active, and drinking enough water. Prevention is key. Strokes are not just a problem for older people. Although strokes are more common among older people, they can also affect younger individuals, especially if these risk factors like smoking, hypertension, or poor diet are present. Strokes in younger people are even more dangerous because they may not be aware of the risks and ignore the warning signs until it is too late. It is important to act immediately if you notice any of the symptoms we have discussed in this video. The sooner you act, the greater your chances of recovery and survival. It is important to consult a doctor as soon as possible. The window for effective treatment may be small. Also, be aware of the warning signs that someone else may be having a stroke. Call 911 immediately if you notice any of these signs in someone close to you, such as sudden weakness or numbness on one side, speech problems, or difficulty seeing. A quick response can mean the difference between life and death, or between full recovery and lifelong disability. Rehabilitation is also an important part of recovery after a stroke. Physical therapy, speech therapy, and psychological support can be part of the rehabilitation process. Many stroke survivors are left with cognitive and emotional problems after the episode. The road to recovery can be long, but with the right support, people can regain many of their abilities. Lastly, but equally important, be aware of the symptoms and signs of a stroke. Knowledge is power, and the more informed you are, the better you can protect yourself and others. Education, medical checkups, or a healthier lifestyle are the best ways to prevent a stroke. Explore our other videos and materials on this topic if you want to learn more about stroke prevention or treatment options. You can also take practical steps to reduce your risk. Our content covers everything from the first warning signs to the latest treatment options and lifestyle changes that can reduce your risk. We have resources to help you make informed decisions about your health. Whether you are looking for detailed information on medical treatments or natural ways to prevent strokes, we encourage you to contact your healthcare professional for personalized advice and guidance. Your doctor can make personalized recommendations based on your medical history and lifestyle. A healthcare professional can explain how lifestyle changes, medications, or treatments can help reduce the risk of stroke and control existing diseases. Do not hesitate to schedule a consultation with a healthcare professional to discuss your concerns. You can also learn about proactive ways to prevent cerebrovascular accidents. Taking charge of your health today is one of the most important decisions you can make for your future. By taking a proactive approach to your well-being, you can increase your chances of living a longer and healthier life in the future. One of the most important steps in protecting your health is recognizing and understanding the risks of serious diseases like stroke. Being aware of the common symptoms of stroke, such as sudden numbness or weakness, especially on one side of the body, difficulty speaking or understanding speech, sudden confusion, and severe headaches, can help you react quickly in an emergency, which can save your life.